our stories.
Casual.
Yeah, we're very casual.
Pull the chair.
Group of presenters, anyways. So just real quick, what we're going to go over today is, are any of you medical students? All right, this is going to be real easy today. We're going to talk about rare disease. If you aren't already aware, there's over 7,000 rare diseases. So out of those 7,000 rare diseases, I'm going to test you guys right now. How many actually have a cure? Out of 7,000 plus rare diseases?
300.
300?
500.
I was going to say just 3 or 4.
3 or 4? Have an idea?
None.
Is the answer 0?
0.
Oh, wow. And
There, out of 7,000 rare diseases, and rare diseases affect 1 out of every 10 Americans. Believe it or not, rare disease affects more people than AIDS and cancer combined. Which, if you look at the scope of it, how much money is put into AIDS and cancer, you'd think there'd be much more awareness and much more science towards rare disease, but there isn't. So our goal today really is to kind of immerse you in the rare disease world, share some resources with you, and then talk about social media, because social media has had an incredible impact on rare disease. So just to give you guys a little bit of information about ourselves, my name is Carrie, Ostrea. I wear, like many of us in the rare disease community, I wear multiple hats. I am a rare disease mom. My youngest was diagnosed with an ultra-rare genetic disorder. She passed away at the age of 3 from her disorder. We also started the Little Miss Hannah Foundation in her memory that works with rare kids in Las Vegas, where I live with. And I also recently became a kind of rare disease advocate strategist, working with a lot of nonprofits and industry on the rare disease community space. And this is my friend Monica, who's going to share a little bit about herself.
I'm Monica Weldon, and I'm President and CEO of Bridge the Gap, SYNGAP Education and Research Foundation. I think I have the longest foundation name in the rare disease community. But my almost 9-year-old twin boy, one of my twins, has the disorder. It's I started the organization. He was the first one diagnosed at Texas Children's. It causes intellectual disability. It's an epilepsy-based gene. SYNGAP1 is a gene, now a syndrome, and many other different secondary symptoms that go with it. And so I was brought in, of course, like my colleagues here, into the space to try to find treatments and cures, or a cure one day, to help these kids live a better quality of life. And so we drive scientific research throughout the world on this disorder, which is growing pretty fast, which I'm happy about. And on to you.
I'm Kristin Smedley. I am president and co-founder of the Carrie Retinal Blindness Foundation. I have 3 children. 2 of them are blind from a very rare genetic disorder that popped up out of nowhere in our family. And now we're on our 6th year with the foundation of we fund research to reverse the blindness and connect the families with resources for not just living with blindness, but thriving with blindness.
And so one of the reasons we asked to share this presentation today with the community is because getting the medical student and the other outside healthcare communities involved with understanding rare disease is really important to diagnosis and how to treat families with rare kids or rare patients. So Monica's going to share a little bit about some medical student opportunities that we have been working with over the past few years.
Well, I've been working with a couple of different programs on the side, outside of our organization, to try to make a team with the patient and the doctors, and having them understand. And are y'all all in the medical? Well, you're either in research, medical field, things like that. Well, if you're anybody a doctor in here? Or a doctor? Because this was my question, because I've always wondered how many doctors, if you think about it this way, you have a patient go into the office, how many doctors actually go into a patient's home to experience what they do at home?
In Europe, they do.
They do? Wow.
They still make house calls in
wow.
some countries in Europe. Yeah.
Really?
Yep.
Wow, I didn't know that. See, and see, that's kind of the concept. Project Doc actually is a nationwide program But I work, of course, I live in Houston, so I work with the Houston Project Doc, and we work with medical students at Baylor, A&M, and UT. And it's actually a requirement as they get through medical school that they have to spend the program here with home visits, doing parent interviews and grand rounds. And what it is we bring these medical students into the home of a chronically ill person, child, and we talk about the transition from child to adult. But it's kind of a shock to our first resident doctors that actually come in, and they cannot believe, you're expecting to walk into a home and see a bedroom, right? Nightstand, clock, whatever. Instead, they're walking to someone's home and they see an ICU unit.
Yeah.
And so it talks about how not just getting the diagnosis, but this is beyond the diagnosis. What is happening and how it's going to affect the entire family and living. So it really sheds light on a bunch of different aspects that maybe a doctor won't see in a clinic. And so we then take those experiences and bring them to the grand rounds and kind of like testify and encourage these doctors to make these families and the patients a team to help better the care and the quality of life of these people that are chronically ill. Some of the results with this program, which actually are published results, 84% of all physicians in training that work with Project Doc are more actually able to take care of children with chronic needs, because most of the time doctors don't, you see the colds, the flu, the strep throat, but really when you have something difficult to tackle, they're like, who wants to have to spend the time to try to, do that? So it's really hard. So it changes their perception. 98% of all the physicians in training rated all the parent teachers very, very highly and took their experience to heart and saw how important it was. The next project that I was able to be a part of is actually, I had a medical student shadow. And in my case, my child's not necessarily in an ICU unit bed, but my child is on the autism spectrum, and we actually took our medical student out with us for the day. And we went to the zoo, and they could actually see and experience the difficulties of what families go through, even with siblings, especially with him being twins. One is neurotypical. So it's a great opportunity for medical students to actually interact with the families. So it totally puts how they treat and how they see diagnosis in a whole different light. And so those are kind of the things that I wanted to highlight, because I think they're super important. It's kind of a reverse clinic idea of bringing patients in and putting the doctors out. So. And we'll go to the next topic.
Well, one thing we just wanted to share is, the bigger one is actually downstairs. It's kind of like the Instagram for the medical world, and it's actually really cool. It's an app that they upload case imaging, and you can make comments on it and help kind of share your thoughts on what you're seeing. And it's a really cool way for the medical students to see things that they may not see in a book, because we know books are published years later, and so it's really a great way to keep them up to speed on things. I just want to go through quickly some resources that are available through patient organizations for the rare disease community. These are 4 national organizations. If you would like more information on that, I'd be more than happy to share them with you. But they go from everything from patient support to building a nonprofit to creating policies that help treatment and research at the federal level and at different state levels for things like newborn screening. And these are just some more organizations. They're a little more focused. Some are country-based, like, for example, Eurotas is for Europe and the Canadian Association of Rare Diseases. We have some more regional-based, like Utah Rare and Rare KC. And there are actually 3 different media outlets that focus on just rare disease news, which is like the Rare Disease Report, Check Orphan, and Orphanet. And these are all available online. The online world is vital to rare disease, and we'll go into that a little bit more. One thing that's been really popping up all over the U.S. recently, and in some of the places in Europe, are Rare Centers of Excellence. These are multidisciplinary clinics that focus on patients with rare disease. One that is really important to our community is the Undiagnosed Disease Network. There are a lot of patients that are undiagnosed, a lot that are still undiagnosed. So what the Undiagnosed Disease Network, which is out of the Harvard Medical School, is it takes the top clinical sites all over the U.S., like Baylor, the National Institutes of Health, and UCLA, et cetera, and collaborate together to take a patient, do some exome sequencing, and see if you can take the top brains in all these facilities to find a diagnosis. So at a last resort, if their physician can't find a diagnosis, you sign up to be one of their participants, and it's an incredible program. But there's also some other rare disease centers of excellence for more defined programs. Like, for example, the Orphan Disease Center out of Penn is a really strong organization. They work with a lot of different types of rare diseases. Duke University has a great facility. And these are just 6 of them. As I said, there's a lot of them starting to pop up, so in the next few years we'll probably see a lot more. And Kristin's going to talk a little bit about some of the educational opportunities that these organizations can bring.
Yeah, so I have a question. I'm wondering if any of you know a blind person in your life. You do?
I coach visually impaired athletes. I coach goalball.
You do?
Yep.
My guys are incredible goalball players.
Yeah.
I
Okay,
mean,
we have to try later.
I've tried it. I've tried it. It is so hard.
Actually, if you look at my
Excellent.
So you were meant to be
It's not
meant to be in
tactile.
this room.
That's right. That's right.
I read the Braille and Sprinkles cupcakes in Stanford, and it seemed to be missing a letter.
That's so awesome.
It wasn't approved, right?
That is so cool you do goalball, because that is the greatest sport, because anyone can play. We actually integrated it now and have my daughter's soccer team plays against the boys, and the boys obliterate them. It's amazing.
Yeah, I love doing it. We do school demos as well. I love doing it with kids for the first time, because nobody is really better at goalball than anybody else, because they're just flying around the floor.
Yeah, it's hard. It's hard. Oh, I'm so glad that you're here. That's awesome.
I wandered in here, and apparently a reason I wandered in.
Exactly.
There you go. All right, well, we'll have to talk afterwards, because we could sit here and talk and just ruin this whole panel. I have to follow a script because I go way off on a tangent.
I'm with you.
So at any rate, I did not know any blind people until 17 years ago when I met my son, and when he was born, he was diagnosed at 5 months old with this very rare Leber's congenital amaurosis. And then 3 years later, my second son was diagnosed with the same thing. So there are 2 of only 300 kids in this country with this rare eye disease. But actually, there's the Center for Disease Control's numbers are 21 million Americans are considered blind or visually impaired.
Can you say that number again?
21 million.
2 of how many?
Oh, 2 of 300.
Thank you, sorry.
No problem. So, I mean, 21 million is a lot of people. Plus, and that's like the popular kids, you know, the macular degenerations and all that. Right? So it's everybody. And the rare eye diseases, now all, no pun intended, but all eyes are on the rare eye diseases because we're the ones having success with gene therapy in this country. It's actually my boy's blindness, but a different gene. So it's a sister gene, RPE65. So we have the success in gene therapy. There's 21 million blind visually impaired Americans, but there's 2 major challenges. The companies can't find patients for clinical trials, and 70% of those 21 million are unemployed, and only 30% of blind kids will graduate high school. So it's like this crisis mode. Why is this happening? Well, what I look at is patient engagement. We heard about it this morning, that patients aren't engaged with their disease groups, and the professionals, the patients, the caregivers are not engaged and connected to the resources to know what is possible in life without sight. And I'm sure you know that firsthand. It's frustrating, right?
It is.
So at any rate, so you know what? How do we address that? Well, I don't know about you guys. If you were what your career is you're pursuing, if you always wanted to do that. I did not always want to do this. I was supposed to be a 3rd grade teacher. I actually was a 3rd grade teacher for a while. And then I was born into this, right? So I didn't know nothing from nothing of how to do stuff. So what did I do? I slightly stalked and then talked to people that were having success. And one of the biggest resources I went to was the Michael J. Fox Foundation, because I don't have people in my life affected by Parkinson's. And I'm not affected by Parkinson's, right? But I know when I hear Parkinson's, take a look at Michael J. Fox Foundation. How do they engage their patient community so well? So I went through and looked, and one of their biggest things is this webinar series that they do. So I gathered colleagues in the rare eye disease community to say, how can we engage our patient community with something like what they're doing? So we're kicking off next month during Vision Research Month, the first ever online Vision Summit. Nobody has to go anywhere. They're all in the comfort of their own computer space. We have speakers, and we actually surveyed the community, say, what is it that you need to know? What information are you lacking? That's how we're driving the content for it. And then the goal is, after that, we have weekly, monthly webinars. It's all housed somewhere that people can go back to and really start getting the information that they're craving. And then we get, on the engagement side, we have patients that are active. So my question for all of you, and we can come back to it later, is, as you're hearing all of the stuff we're talking about today, what resources do you know of in your arsenal of digital resources that might be able to support something like this? How to house the webinars, the better platforms to use, and then how to spread the word. So just something to keep in the back of your mind.
Very cool. Now, as Kristin and Monica and I shared, social media has had a tremendous impact on the rare disease community because, for example, in my daughter's case, she was one of 50 in the U.S. who was diagnosed with this condition. Well, how do you find, the other people in this community? Social media gave us a home. When you have a medically fragile, medically complicated child, you don't have the luxury of going out and doing the mommy and me and things like that. So it not only gave us a home to connect with other parents like us, it gave us a home to connect with researchers, to people in other parts of the country, and the parts of the world. And so we wanted to share a little bit more about how social media has really played a role in our rare disease community. Now, how many of you are on Facebook? Facebook? Okay, let's go back. How many of you are on Twitter? Okay, now you have to stay and play now. What about LinkedIn? All right, so you guys are all into it. Well, the way that the rare disease community looks at it is Facebook is our support community. This is where we find other parents, other patients like us. This is where nonprofits can take advantage of the free platform to share their news, to share their research, and to connect with people. It really is how we built our communities. Each of us within our own rare disease spaces have a community built specifically for our disease or our disease family. Twitter is where we get our information and where we advocate. This is where we connect with policy leaders and researchers and academics. So it's really used for that exchange of information. Whereas LinkedIn is also used for information and advocacy, but more with professionals, pharmaceutical leaders, heads of academic institutions. Where a lot of our rare disease advocates, we're considered kind of the crazy advocates because we really go full force on this. This is where we can make a lot of connections with people who can help us drive our needs forward. So I'm going to ask Kristin to share a little bit about her social media story, because I think you'll find it interesting how all three of our groups use social media differently, but we still have all positive results.
Great. So our foundation is the Curing Retinal Blindness Foundation. It's the only patient organization in the world for CRB1 retinal disease. Like I said, I have 2 of the 300 CRB1 LCA kids. There's a second piece to the CRB1 retinal disease, and that's the retinitis pigmentosa side, which you may have heard that term before. It's a later onset, so those kids aren't noticing an issue until eye charts and school and stuff like that, maybe around 10, 11, 12 years old. But regardless, everybody that has this retinal disease by adulthood loses just about all vision. So we are now in the U.S. We also have families in Saudi Arabia. We have Mexico, the UK, and Australia just came on board. But we did not start there. We didn't start there at all. Can you click for me? Sure. So my diagnosis day with my first son was like this. The beautiful life, and then suddenly the 3 of us were in a boat paddling around trying to figure out, I mean, we had no idea. Like I said, I did not know a blind person at that point, so I had no idea what to expect. Nobody knew, we didn't even know the gene yet, we just had heard LCA, and we were trying to find resources. So the day that I was told that my son was blind, I was also told he would never play baseball, which he eventually did and won a championship game. I was told that he would never drive. We're still not driving, but he is getting on Google's list to try out one of their cars. He's 17, he's a little crazy about all that. We were told that he would have to learn Braille and walk with a white cane, and then we were told, good luck. And that was it. 3 years later, when my second son was diagnosed, good luck was still the protocol to tell me. That was it. So, if you click that, nowadays, if you call the Caring Retinal Blindness Foundation, there's this ripple effect. You make the phone call, and then it's this ripple effect of resources and people to connect to and role models and all of that. But back then, I had to one-off this whole ripple effect. I was all over the pond trying to figure out how to get all of this done all at the same time, which is what happens to so many rare disease families. If you can click the next one. So, I'm out there creating this ripple effect, trying to find all these resources, right? And all I wanted was one phone call for somebody to be answering, saying when my son wasn't going to be able to see the soccer ball anymore, and when they weren't going to be able to trick or treat on their own anymore, and there wasn't, and I was so darn frustrated I was losing my mind, right? So Richard Branson says, if the best ideas come out of frustration. So the idea emerged, create the resource for CRB1 retinal disease, the one that didn't exist, make it exist. But then the challenge was, okay, if the numbers are that there's 4,000 kids in the United States, roughly, how am I supposed to find them all? How am I supposed to find them? Do I go to their doctors? How do I do this? And along came good old Facebook. And I know people can whine and complain about waste of time on Facebook, but let me tell you, the power of Facebook. Now I will say that 2011 is probably on Facebook's books. It's the year that Kristin Smedley crashed the servers. And they had to hire more staff for all the posting that I was doing and getting going. But 2011 was the year of the tipping point for CRB1 retinal disease, because I put a post on Facebook a few times that basically said, who out there has a hashtag CRB1 child? And within a couple of weeks I had moms messaging me that they had CRB1 kids. And within just a few months, we had enough families to launch crb1.org with all of their stories and get research going. That was Memorial Day weekend of 2011, and by September, our first fundraiser was our first $20,000, and we've crossed the $1 million mark, and we've got research going all over the place, actually all over the globe. So it was, the power of Facebook is absolutely, and this is just a visual of, this literally was, it was just me, and within weeks, months, and years, I mean, you could put even more faces up there. It's just the power of social media. It's just a matter of harnessing it now. You know, what else can it do for us? And then there's a new group that's emerged, a new platform that picks up where Facebook leaves off. So if you can click that one. So this is called Inspire, and we just became partners with Inspire, and I highly encourage you to look at this, because Inspire is, I describe it as an organized Facebook. So you can go in, we are the retinal blindness community on Inspire, and you can go in there and start a message, but you can go back and search it, and you can watch all of the comments stick with that message and then find it later. It's moderated, so you don't have some of the crazies. You know, I think maybe they're there, but they get deleted and pulled, right? So it's such an excellent resource, and you can go on there and find all kinds of medical conditions that you can really get involved and connect with professionals, other patients. It's an awesome resource. So if you can click to the next one. So this is remember me on the water with my little family. Now you get CRB1 retinal disease and many, many rare eye diseases, because now we've escalated to we've become the face of rare eye disease. Now, you're in your own marina now. Now you've got all these connections that these people are coming in. And honestly, in my humble opinion, there's no doctors in the room, which we'll get to them.
We are going to get to them.
In my humble opinion, I believe, and this is my mission and my goal right now, I believe that if a doctor's going to deliver a diagnosis of CRB1 retinal disease, and really with any disease, they should be delivering the diagnosis and delivering you to the marina where you have all the resources. They are the catalyst that can make all that happen. Yeah. So my question for all of you, because maybe it's the third grade teacher in me, I'm always posing the question for you to think about, is what other social media platforms are you really ingrained in and know the nuances? You know, each one has their own specific little nuance, and how can that translate to to something like a rare disease patient organization, to spread the word. We're actually circling back now to go find all the patients again, because we hit it off really big, but then we had to get the research going and so many other things, and natural history studies and registries, and now we're going to circle back, and that's the big question, is how do we harness all those platforms to find all these folks, going through where are the doctors sitting and getting their patients, and these guys, maybe on Facebook. So it's something for you to think about. And then I just wanted to finish with one of my most favorite quotes of all time, happens to be from Helen Keller, which is, alone we can do so little, and together we can do so much. So thank you.
That was pretty cool.
Oh, is there a question?
Yeah, I have a question. You were talking about different platforms, and everyone has talked about how young the people dealing with these rare diseases are. Are any of these groups on Snapchat or Instagram or some of the places where they're younger?
That's a great question, and I am on Snapchat for our biggest fundraiser, the one that has raised over $1 million. That it's all kids, but it's so funny because I try to figure it out, and my teen committee takes over the Snapchat for me.
I'm on it solely to chat with my 14-year-old goddaughter.
That's the only reason I ever chat with my kids. She just said that today about her kids.
But Instagram also gets out to so many different people.
Yeah, I
So
just started getting to know Instagram, and then so my thing is that and maybe we should exchange emails or something. My thing is I got to know the platforms, but how each one of them has to have a different interesting way to make it a big impact. I don't want to be just posting on Instagram or just snapping.
Yeah.
How do I do it in a way? I know with Twitter it's the hashtag, and I know that I'm good with
Because my
that.
husband somehow connected his Twitter account to all of his other
Oh my
accounts.
God.
There's a
Instagram
method
does
to do
that.
it. I don't know it, but
I think of Instagram as being more about inspiration, so I think it'd be really useful for stuff like fundraising, like you were saying, Twitter is about advocacy
Very good.
and more of the scientific knowledge, whereas I think Instagram, just because you have such beautiful pictures, if you had although maybe with an organization dealing with blindness, maybe that's not been the right place.
I got my blind friend on Twitter.
Yeah.
Not blind Twitter and Instagram.
My blind sons are on all of it.
Yeah.
Okay, Snapchat's tough for them, but they did just get some accessibility features.
Yeah, and
They're just so much. They're definitely young, and I feel like they're even more emotional. Like a lot of teens aren't really on Facebook anymore.
No, it's the old person thing.
So our trick is we have to find the parents to get their kids in our organization. But now a very interesting thing, and I don't want to hog the time. A very interesting thing is we have a teen that is very interested in being connected with the organization, but the parents aren't.
I was about to say, I think having them on Instagram or Snapchat would be a way for teens to be able to take it into their own hands and to feel
Oh my
like
God, we should have the teens in our organization run the Snapchat and Instagram.
Yeah, give them I have a business. That's what I do with my Snapchat. I have a team.
You two need to connect.
That's brilliant. Okay, I gotta step off because we're gonna.
We just have a few minutes left, but I just wanted to share a little bit about this picture. My daughter had Gaucher disease type 2. That's her on the far corner, Monica, if you want. That's my little Hannah. We had one good medical day after she was born. The second day is when our whole medical odyssey started. She was in the NICU for a couple weeks, and it took them 5 months to diagnose her. When we were at Texas Children's Hospital, which is one of the top medical genetic children's hospitals in the country, and we got the diagnosis, and she was sitting there just playing on my lap, happy, smiley. She was 8 months old by the time we actually got the official diagnosis. And they said, well, she's got this fatal disease, just take her home and love her. That's like you being sent home with good luck. We were sent home with nothing's going to be here for you. So I immediately started blogging because this was before social media. It was in 2008. And people started finding me through the blog. Now, Gaucher disease type 2-3 is what they consider ultra rare. She was one of 50 kids in the US, 300 worldwide. So trying to find these families who have this ultra rare disorder was really hard, but they started coming through my blog. And as I started getting more people connecting with me, Facebook started really hitting its popularity around 2011. So maybe we did that together.
Yeah, we crashed it together.
And we developed a community on Facebook, a private group. And as a fun little project, we decided to put together all of our kids' pictures as our cover picture. And it's a lot of cute little kids. Unfortunately, most of these kids, probably at least 80% of them have passed away by now. But we noticed something about this picture. I'm going to give you just, take a look at all the babies and see if you notice anything similar.
They look pretty happy.
Well, they were. We were good at making our babies happy. If you notice, all of their noses are the same, physically. So we're looking at this picture with me and one of the other parents, and we're like, look at all their noses. They're exactly the same nasal bridge, the same formation. And I brought this to the attention of our natural history coordinator at the National Institutes of Health. I'm sending you this picture. All the babies seem to have the same nose. What do you think? And she's like, oh my God. This is exactly it. It's the first physical characteristic of Gaucher disease type 2 and has now been published in the medical journals.
Oh, so cool.
That is the power of social media within our community. And I'm going to let Monica share her story because it's just as incredible.
Okay, well, in our organization, we're only about 2.5 years old, and how we used social media to encourage our scientists to get involved, and not just doctors and clinicians. Of course, we had to poll the group. We have a closed group, and one of our scientists, he goes, I want to be a part of this group, so he wanted to join the group, and we vet all our members in our group to make sure that they have a child or an individual that they're caregivers of, or SYNGAP 1. And I'm talking to my administrators going, well, do we let the doctor in? do we let him in? Because we're thinking about, how would the parents feel? So we actually polled the parents, and they said, yes, let our mouse model scientist in our group. So what ended up happening is actually, it is what the parents talk about in the group are the medications, the behaviors, all the little tidbits of data that could possibly drive a direction for treatments, and also finding clinical endpoints for experiments for mice they're doing in the lab. Because of course mice and children, humans, are different, right? So we're trying to get to a point where we can use this data to do preclinical planning for a possible clinical trial one day, and what would be a good endpoint to measure. So now we have this mouse model scientist looking at, and he's like, wait, hold on, maybe we're doing this all wrong, because he can actually see what's important to the parents to treat their children or what they're concerned about. And so it has taken the direction of the research in 2 of the labs that we're using now and totally changed it, because we're going in the wrong direction. So we finally are on an accelerated path to drug development for our kids. In fact, me and one of my researchers, we used Facebook because we're just now beginning our natural history study, and we're constructing our surveys, and we have not yet put them in our natural history study yet. We got an IRB approval for a survey on Facebook within our closed group. We use that data, and we're actually publishing a paper together this summer on data we collected from Facebook. And so it's just a wealth of information, and those little things that you can capture from that to put your disease in a direction where we can accelerate this thing if we've got the right stuff. So that's kind of like my story on using social media, other than just chatting and sharing pictures and all the other stuff. It's just highly valuable to the scientific world and research.
So we want to thank you guys very much for hanging out with us. This is a little quote that the key word for the rare disease community is hope. Everything we do drives to hope. And I just wanted to share this. This is something as parent advocates that we feel every day of every week, of every year, of every child, every patient we work with. So thank you guys for your time. If you guys have any questions, we'll be around the rest of the day. And I know you guys are ready. You're ready to go next and jump in. So.
It's this whole weird timing thing.
I
Like
know.
3:07. I'm not sure what that means.
Yeah.
We weren't either.
Yeah. Okay. Thank you guys very much.
Thank you.